Do you think one day AI will be able to detect diseases and things better than human doctors? Really interesting questions. Can you be born with worms? Why do farts sound like gunfire? And if your body regenerates skin, why don't nipples grow back? What? Yep, these are real medical questions, and today I'm answering them all. Get ready for the weird, slightly gross, and totally fascinating medical questions you probably never thought to ask. All right, let's dive right in. Where does your body separate pee and poop from, since all food and water enters through the mouth? Well, that's a good question. Our digestive system as well as our urinary system. And so what ends up happening is everything gets into the stomach and our body's breaking it down and passes through the intestine, then goes through the large intestine and makes its way out. So you're absorbing nutrients, you're absorbing fluid, and then you're also kind of letting the mass of all that food and liquid kind of go through your system. And so what happens is the small intestine does most of the nutrient absorption and some water absorption. Then through your large intestine, you get a lot more of bulking, so water absorption. And if things aren't working correctly, that may be when you end up getting diarrhea and things just kind of shoot right through because it's liquidy. That is where your body basically starts concentrating excess fluid and nutrients, keeping some and getting rid of the other abnormal waste. That is one of our filtration systems. And so you get rid of the liquid, basically waste out of your kidneys. Does sugar actually make people hyper, or is that a lie my parents just told me? So the short answer is no, it's a myth. But sugar doesn't actually cause you to be hyperactive, but it could, cause you to have a boost of energy, but a very short boost. Sugars break down into, we know carbohydrates and glucose give us energy. And so the issue with refined sugars, very quick surge of energy, but then your insulin kicks in because of the high dose of the sugar and the carbohydrates. Insulin then plummets the sugar back down and could make you more fatigued thereafter. So it's a very short-lived scenario, and it shouldn't be used all the time to, boost your energy, because you're going to be doing this all day long. You need something that's more sustainable. Are phobias learned, or can someone be born afraid of something they've never seen? I'm extremely afraid of bears. I've never seen a wild bear in person. So really good question, and the answer is yes and no. So phobias are both in us and they are also learned. Super cool and really interesting is it's almost the innate component of our fear, or like what we call ancestrally, bears and large predators are not good for us. So we've learned over time, and it's like encoded in us. Do you guys have any unique phobias that you want to share? Let me know in the comments. What am I afraid of? I mean, I don't like snakes. I don't like reptiles. I just stay away from them. Am I like horribly fearful of them? No. If my body regenerates skin, why do nipples never grow back if they get injured? So really good question, but there are two different types of specialized cells. The skin, or the dermis and the epidermis, they have specialized cells that allow them to regenerate and heal. Your nipple has very specialized tissue, and it's very different. It's glandular tissue and subcutaneous tissue that's different than what's underneath of our skin. And so when that actually gets injured, it grows back like a scar. So the nipple has a very complex structure to it, so it doesn't react the same way your skin would when it needs to regenerate from an injury. Doc, I've got a question about hydrogen peroxide. Would it be safe and effective for humans to ingest a bit of it if someone has accidentally eaten something poisonous, perhaps mushrooms, and we tried to make them vomit it out? My veterinarian has often successfully used this method when his other dog patients accidentally ate something they shouldn't have eaten. So the answer for a human is absolutely not. Please do not ingest hydrogen peroxide. It can cause burns, it can cause internal bleeding, it can burn your esophagus and your stomach, you can have perforations. It is dangerous, don't do that. Dogs are different, and dogs have a little bit different makeup, and they're using a very small amount. We have the ability to treat poisons with different types of antidotes that are very specific to them, and please go to the hospital if anything were to happen. Also, There's a number if you accidentally ingested something and you're concerned about poisoning in the United States at least. There's a free 1-800 number, 1-800-222-1222. That will get you to the local poison control that you can talk to. Why do some people's farts sound like gunfire and others sound like a sad balloon deflating? Farts contain nitrogen, oxygen, hydrogen, methane, all different combinations of this stuff. So just be careful, please. Don't light them on fire. They could cause issues. And people fart 10 to 20 times a day. The sound of the fart has many different factors. So the sphincter is basically your butthole. Sometimes it could be tight, could be relaxed and loose. Can you be born with a pork worm or any other worm inside of you? No, not unless your mother typically has an active infection, but it gets kind of complicated. So there are a lot of different parasitic type infections out there and worms. And so typically to be able to get it from your mother to the baby before you're born, it has to be able to cross the placenta. And so there are some parasites that can do that, like toxoplasmosis, but usually if they are larger worms, you can get them passed from mother to child, but usually it's during the birth process because of the size of the worms. How are you, doctor? Oh, I'm good, thank you. A question for a possible next video. It is known that sleeping 8 hours a day is healthy. The question is, if you sleep 5 or 6 hours a night and nap 2 hours a day, do those hours count as those hours? Oh, the good question, but not exactly. You really want to sleep continuously to really get the effects of REM and non-REM sleep. So deep sleep and then REM sleep, rapid eye movement type sleep. And it has to do with the quality of your sleep, not necessarily the quantity. We do know, studies do show we need a continuous, 7 to 9 hours of sleep for our bodies to recharge. Now, sometimes getting a 2-hour nap might make you feel better, give you that extra boost and feel refreshed. But in general, you will do better with a continuous 8 hours of sleep versus a broken 6+2 sleep pattern. If you are struggling with sleep and you need an extra boost or a little bit of help in that department, check out Do Not Disturb by my company, Life Happens. It's formulated with bioavailable magnesium, L-theanine, and passion flower to help you get that restful night of sleep that you all deserve. If you're interested in Do Not Disturb, you can find it at lifehappens.com or on Amazon. Is there any research to suggest a link between gut health and mental health? Yes, there is. There's very much something called the gut-brain axis. So the gut bacteria influence the neurotransmitters in our brain, such as serotonin. So if you have something called dysbiosis, or basically a dysregulation of the gut microbiome or the bacteria in our gut, it has been linked to, say, like anxiety and depression. Versus we do know that once it's restored or you're starting to use probiotics, your mental health does improve with the use of probiotics and restoring your gut microbiome. If someone donates their face in a transplant, does the recipient actually look like them? Well, sort of, but not exactly, but really cool, right? The recipient still has the structure of their face, so they still have the bone structure. So there's a mix of the two, the skin and structure from the donor and as well as the structure of the recipient mixing together, kind of show a little resemblance of both. Is washing your hands with warm or hot water really better than using cold water? It seems like water won't get hot enough to kill germs without burning your hands. So yes, washing your hands with warm or hot water does not necessarily change the effect compared to cold water. To kill the germs with hot water, it needs to be like super hot, like 60 degrees Celsius, 140 degrees Fahrenheit, and our bodies can't tolerate that. So warm water can maybe help with the oils that are on the hands, but in general, the soap is what breaks down the germs, thus cleaning your hands. I know someone who hears a weird clicking sound when they move their eyes. Is that normal? So yes, hearing a clicking noise when you're moving your eyes is unusual, but it's not necessarily dangerous. So there's something called ocular crepitus, which is basically that sound, or something called superior oblique myokymia. Basically, you can get a little bit of air trap, and with different movements, you hear it pop. Well, it's almost like cracking your knuckles. If you continuously hear clicking noises, or it's going on for a long period of time, or you have any abnormality with your vision, you need to go see the ophthalmologist. You can go see the obstetrician, but the ophthalmologist is the eye surgeon, and that's who I would recommend seeing in this circumstance. If your bones heal stronger after breaking, why don't people just break all their bones to become unbreakable?
Nice.
So great question, but the superhuman strength is only temporary. When you break a bone, yes, you overproduce these cells to build up your bone and make it nice and strong and thick and calloused, but over time, the body continues to remodel itself to make that bone back to its normal strength and structure. So repeatedly breaking your bones actually makes them weaker, increases the risk of osteoporosis, and it can lead to misaligned healing, chronic pain, and nerve damage. Please do not break your bones. Do you think one day AI will be able to detect diseases and things better than human doctors? AI is already around, and it's already doing incredible things in detecting subtleties, tumors, cancers, helping with medical diagnoses, but I don't think it will eventually totally replace doctors. But could in the future? Maybe yes. The AI, the computer lacks empathy and the feelings, so I don't think it will totally replace it. I definitely see it where there's going to be AI assisting physicians and doctors to help make better clinical decisions, more accurate and quicker diagnoses, and pick up subtleties or things earlier than maybe a human would be able to. Is it possible to get pregnant if you are already pregnant? Yes, but super rare. It's actually called superfetation, where basically you have a baby that's developing within the uterus, and for some reason, the ovary releases another egg, which is super rare. So then if there are sperm around and then there's an egg there, there is always the potential of fertilization if all the stars are basically aligned, having to do with timing, and then it could implant into the wall, and you can have a second pregnancy and then have different timings of your pregnancy. I've never seen this, but it is something that theoretically can happen, and it's rare, but does happen. Really interesting questions and pretty amazing. I hope you guys learned something, and if you have any more questions, please leave it in the comments below or send it to any of the social media outlets that we have and use. And if you guys enjoyed this video, definitely check out this playlist right here. Make sure you binge watch everything. And as always, do me a favor, subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.